I've been a medical specialist in Palmerston North, Levin, and a short while in Wanganui as well over the last 33 years. Why does the John Key-led government feel that they have a mandate to secretly negotiate on our behalf, to give enhanced trade opportunities to a corporation which kills half their customers, our fellow New Zealanders? Do we share any of the values of the tobacco corporations who slowly kill half their customers? Is the tobacco industry our friend? It was interesting in researching this afternoon's presentation to find out that there are two national MPs who in fact were executives in Philip Morris Tobacco, Todd Barclay and Chris Bishop. So it's difficult to see that they would not have a vested interest in the outcome, and they will presumably vote towards the trade deal. Is the New Zealand government representing, protecting and enhancing our interests and welfare? Are John Key and Tim Grosser really acting as our friends? Although American corporations, as has been said, have had access to the TPPA text, this remains a secret to all but the government negotiators in New Zealand. They have ignored their Treaty of Waitangi obligations to consult with Maori in this process, and if it wasn't for WikiLeaks, we wouldn't know details of the negotiated agreement until 4 years after it's been signed. Pharmac was established in 1993 to negotiate, purchase drugs, vaccines, and recently medical devices have been added to that mandate. And they do this within a capped budget for our public health services, both hospital and community services. Pharmac's hard bargaining with drug companies and manufacturers has saved us over $5 billion since 2000, since the year 2000. Australia have calculated that if they had the equivalent of Pharmac, or let's say if they had the same quality of negotiating skills as Pharmac, they would save over $1.5 billion per year. Absolutely massive. As a result of their success, Pharmac has become the direct target for American corporations in these TPPA negotiations. The Americans are even demanding that our laws and policies relating to Pharmac are changed before New Zealand is able to benefit from the trade negotiations. The TPPA proposes, as far as health is concerned, increase direct marketing by drug companies via the internet. So they are demanding internet promotion to health professionals and to the public. And they aim to do this by raising expectations of the public, releasing early and before peer review of the quality of medications or devices. This is the latest thing since sliced bread. It's better than you've had before, but of course it's going to cost you twice as much. So it's going to raise expectations and to put pressure, to encourage health professionals and the public to put pressure on Pharmac to publicly fund these new drugs and new devices. The proposal of the TPPA is, or the proposals that we believe are there, will undermine Pharmac's strength to negotiate. It threatens to increase corporate litigation under the investor-state dispute process because of loss of expected future profits for the shareholders. Drug patents will increase significantly. The number of years that those patents are live for will increase significantly before cheaper generic drugs become available to us. It is likely that costs of medical devices, and those include heart pacemakers, cochlear implants, new joints, hip joints, knee joints, surgical materials, and even wheelchairs, that the cost of these will increase as a result. Although John Key has assured us that costs will not increase for individuals, as he's been quoted, the taxpayers will of course have to pay more to cover the increased costs of the health budget. Now, the only way that can be done within a fixed budget is to take money off some other department, some other aspect of the health, of another department's budget. Or there will be fewer drugs available because of the increased cost of some. Fewer medical devices will be publicly funded or subsidised. Therefore, co-payments will have to increase, and those in most need, the most socioeconomically disadvantaged, the poorest, will lose out, and others will accept they will have to absorb the increased costs if they want to have those products. The increased costs for drugs and vaccines, and because an area which is often forgotten is the cost of vaccines, which to us we take it as for granted that we will have vaccinations. However, if you lived in a developing country or third world country, it's very easy to overlook the fact that the TPPA agreement will influence the cost of vaccines and drugs to these developing countries. The costs to aid agencies in the third world are benchmarked against cost in developed countries, and it will result in a lack of affordability and preventable deaths of hundreds of thousands of people in the third world if this agreement goes through with protection for these big drug companies. The TPPA demands reduced sovereignty and control of public health initiatives, those which are intended to improve the health and welfare of New Zealand citizens. Such demands will include and undermine tobacco control, for example, whereby we're trying to achieve smoke-free status by 2025. Now, if the tobacco companies have increased influence, there's no way we're going to achieve that. Alcohol consumption management is intended to directly reduce adverse health outcomes with regard to alcohol sales availability, with the intention not only to improve the health of individuals, but also to indirectly reduce family violence, drink driving, and other offending. Obesity management is another area of public health initiatives. And the intention is to reduce marketing and consumption of high-density foods. This will be inhibited and make it much more difficult if the TPPA goes ahead, with protection for those companies marketing foods. All these initiatives could lead to litigation under the ISDP, and as has already been said, we've got litigation occurring in Australia and Uruguay, and I was interested to see the person who's been leading the initiatives in Uruguay is their Minister of Health, who in fact is a cancer specialist. And his intention was what he wanted to do was to increase the health warnings and the graphic pictures on the front of the cigarettes, and lo and behold, they are being sued for it by the tobacco companies. And the reason they're doing that and the justification is for loss of expected future profits for the shareholders. Tim Grosser says he and the negotiating team are not dummies. They're behaving like it. We need adults to do this. He considers those opposing these secret negotiations to be ideologically opposed to all trading. that we are all politically irrelevant and we're behaving like breathless children running off at the mouth. What arrogance. What we want to know is what is on the table. We want to have open consultation so that we can all be involved in making informed decisions on these trade and other proposals. We, the taxpayers, the citizens, will be living with and will be paying for the outcomes. Tim Grosser and John Key, we demand you treat us as adults. Thank you.